Topping our coronavirus headlines this Monday, a CDC advisory panel prepares to take on the issue of booster shots this week, coming after the FDA voted against a third shot for the general public, citing the need for more data. Emory University's Dr. Winawer joining us live this morning to talk about this and a whole lot more. Okay, let's jump into this, Dr. Winawer. Friday, the FDA advisory panel supported limited boosters for those 65 or older and high-risk populations too, rejected a broader application. Why is that?
Yeah, it's exactly like you said. It's all about risk-benefit. There are certain groups of people who do worse with coronavirus infection, and those are the elderly and people with comorbid conditions. So patients who have chronic lung, liver, kidney disease, patients who are immunocompromised, people with diabetes, heart failure. We've discussed this previously, but in all groups, that's not the case. And I think it's important to remember a certain construct. Our antibodies, and we've all become familiar with this now, our antibody response and antibody titers, they wane over time. But we also have memory cells, and those memory cells can jump right into action and remember a coronavirus infection quickly and ramp up the body's antibody response. So just because your antibodies go down doesn't mean you're completely more vulnerable to infection. And I think the FDA panel looked at the data and just said, in younger people, we're just not there yet. We may be, but we need more information. But in older people, those with comorbid conditions, and also those on the front lines who are at greater risk of acquiring infection, the data supports it. So it's a matter of risk-benefit and what the data is telling us. And stay tuned. This is an evolving area, and we'll hear more about it in the next few weeks and months.
Yeah, you said evolving, that's for sure. This morning, Pfizer saying that its vaccine is safe for kids ages 5 to 11. So we'll have to wait and see on that one for sure, Dr. Winawer. Okay, so last week, Nikki Minaj, we all heard about this, right? Prompted quite a stir with a tweet in which she claimed that a cousin's friend had become impotent after receiving the COVID-19 vaccine. Okay, any truth to this?
Absolutely 100% no.
No.
I've been hearing this from a lot of different people, and this is incredibly irresponsible. She has over 22 million Twitter followers. And if you think this might be the case, what you do is you get permission. This is anecdotal, right? A friend of a friend, my cousin's friend. If you think that this is the case, this is what your responsibility should be. Ask permission to speak to the physician who treated the patient, and then ask that physician to then publish the data, present it to your peers, and then produce a case report where it's out in the literature, and then it can be analyzed by your peers. This is so anecdotal. We don't have any evidence to suggest. There's no testicular swelling with this vaccine. That's what she wound up saying. We'll get that out there right now. There's no data to support that. So just putting it out, it's going to dissuade a lot of people, or potentially a lot of people, from getting the vaccine. And there's no data that supports that it causes infertility.
And segueing into that vaccine hesitancy, millions say they want to do their own research. Let's discuss that. In the age of disinformation, is that a good idea?
Yeah. Yes and no. I think it's good to have a natural skepticism, and it's good to want to be convinced and not just believe everything and be naive and believe everything you hear. That point of it is appropriate. But when people say do their own research, they're not scientists, right? So do their own research means that they're most likely going to go to Google and type in whatever question that they have. And then you're going to get information or disinformation on both sides of the argument. And we come to this with our own inherent biases. So if we're thinking that, I don't want to take a vaccine, you're going to find information out there that can support that view. But what you really have to do is you have to consider the source of the information. Once again, is it peer reviewed? Is it a group of scientists who know how to study the literature? Is it from people with a public health background or a medical background or a background in infectious diseases? These are the individuals you want to listen to. And for those out there who want to do their own research, look no further than almost 100% of physicians have gotten the vaccine. Also, since May, there have been, unfortunately, 100,000 deaths in the U.S. from COVID-19 infection, and almost 100% of those people were not vaccinated. So start from there, do your own analysis, but really you have to go to trusted resources to be able to make an accurate opinion.
And you are one of those trusted resources. We appreciate you, Emory University's Dr. Neil Winawer. We'll see you next week. Good seeing you.
Sure. If anyone has any specific questions or want to challenge me or ask me anything, they could always
challenge. Oh,
yeah,
my.
you know, I listen. I appreciate a good scientific inquiry. So if anybody has any questions, they could always find me on my Instagram at Neil Winawer and ask away. I'll be happy to discuss those things.
Thanks, Dr. Winawer. See you soon.